All right, so for today, what we're going to do is I'm going to show you how to become a client or if you need to use Healthcare.gov. Okay, so what ends up happening is people like me, licensed people, need to have a license. In addition to that, we need to be appointed, or get permission on Healthcare.gov. Some people call it FFM, Federal Facilitated Marketplace. That's fine. Anyway, you can go down here, you can see Find Local Help. And even if I'm not located where you are, that doesn't mean that I can't help. So we go here to click here, search now. Let's make sure this goes. Here we go. And there we go. So what will happen is all the persons that have permissions, on the federal marketplace, they're enrolled here. We had to, make sure that we were actually signed up, and every year we have to pass some light testing. That has all been done. So instead of your local area, what I put here is you can put in here 48103, and that is the Ann Arbor, Michigan zip code. You can go, whoops, let's see here, 48103. Come on, there we go. Ann Arbor, Michigan, search. What will happen is it'll come up with a listing, and there are other ways to get to me, but let's just use this one. That's easiest. And up will come up all the people who are within spitting distance of Ann Arbor. And here it comes up slowly. Apparently my internet is not that fast. There we go. Blah, blah, blah. These persons, I don't know these persons. I'm not sure of, how good or bad they are. Let's presume that they all know what they're doing. Here, as we scroll down, I want to say that I'm on the second page. Yep, there we go. There I am, and you can download contact. There's also my email address, etc., etc. More details. Never have done this. And I just left these as wide as possible because, we have clients, I have clients all around the country in different locations. And there you can go, email. That's it. That's all you need to do. There's your proof here that, that I am, part of Healthcare.gov, can assist in your location. If I don't have a license in your state, which is possible, there are some states that I don't have a current license. Getting them switched on is not a problem. Before I make a recommendation, I will accommodate that. And even in that instance, that has to also be appointed with, the carriers. If that combination doesn't happen to exist for you, don't worry about it. There are other ways that we can still go through the process and you can get the right information. That's it for today. Healthcare.gov for those persons. Now, who are you? In other words, and I'm going to switch to another place here because this is for Healthcare.gov compliant plans. That isn't the full suite. And what I'm going to do is I'm going to show you this other website, which is my book's website, Maximize Your Medicare. And, all across in different banners and stuff like that, you will see much more than Medicare. And there's a reason for that. So as the site comes up for the book, what ends up happening is I've created a new page called Enrollment Central, right? And Enrollment Central, and here's the thing about Medicare as well as health insurance. It can be very easy just for a single person. But as soon as something moves, even a single variable changes, stuff changes. You're married. You have access to employer-sponsored plan. Your coverage got canceled, whether it be by choice or involuntarily. For example, you got laid off from your job. Something that's happening, 1 million new people filing for unemployment claims every week since COVID-19 began. That's what creates a complication. In addition to that, very complicated to go through healthcare.gov. I can't stress that enough. You can't just go in there and bang in your information and presume it's going to be okay. You actually need to know exactly how you're filling out these applications, especially if you're trying to get the APTC or the subsidy to lower your premium. And in addition to that, to lower your deductibles and your out-of-pocket maximum, which is called CSR, cost sharing reduction. You need to be very careful. Some of you, compliant plan is not, it's not practical because the cost is still too high. If you don't qualify for the APTC, that can happen. That's affecting a lot of persons. But nevertheless, perhaps you still want to have health insurance. I do suggest that people at least consider, in that instance, short-term health insurance. You can listen to the podcast. I just released a podcast, an episode, where I talk about short-term health insurance and the fact that the criticisms of short-term health insurance are really not correct at all and are so biased to the negative that it basically leads you to believe that it's totally worthless. No, it's not. It's not. It's literally you're accepting more risk, but you're paying much less. That makes total logical sense for many people. So anyway, here's a good place, short-term health insurance. You can just click here on the orange bar and you can get your live quote. And this is the one, for example, this is one of many. So again, I'm broker. I don't have a religion here, meaning that I don't care. I don't care to say that this particular policy or this particular carrier is the only one. There are many. We'll search them out for you. I'll find it for you, the one that suits you. Maybe even these prices are too high and you need a lower priced plan with more limited coverage. Okay, that's totally fine, right? I mean, I tell my clients, kind of joking, but actually not really. I sell gum here, right? In other words, I'm like you're the 7-Eleven owner. You want Big Red? So be it. Trident's your best? Fine. Extra? Okay. Right? That's not my job really to dictate to you. It's not my job to dictate to you exactly what you should be choosing. I'm here to listen, to hear what would fit your need, what your budget is, where you live, what your employment situation is, et cetera, what your financial resources are to find the gum that is best for you. Setting the price. I don't set the price, right? I have zero control over that. And so you can actually find your online quote right here. Okay, that's it for today. You now know how to hook up with me on Healthcare.gov if that's the path you want to, if you want a compliant plan. In addition to that, if you need a short-term plan, have that type of inquiry, it's all here. The links are here in the video, and be sure to like and subscribe. Speak with you next time.